An Nclex Medical Surgical Nursing Review on Cataract, presented by Tito A. Gala, BS Nursing Regis. What is cataract? Cataract is a clouding that develops in the crystalline lens of the eye or in its envelope. It has varying degree from slight to complete opacity and obstructing the passage of light. It is a vision-impairing disease characterized by gradual, progressive thickening of the lens. There are various causes of cataract, and some of them are as follows. Some epidemiological information regarding cataract are listed below. The pathophysiology of cataract is multifactorial, involving complex interactions between various physiologic processes. There are various types of cataract, namely immature senile cataract, mature senile cataract, hypermature senile cataract, and others. The most common treatment for cataract is cataract surgery. When a cataract is sufficiently developed to be removed by surgery, the most effective and common treatment is to make an incision or capsulotomy into the capsule of the cloudy lens in order to surgically remove the lens.
You know, as our population has aged, what used to be old at 50 or 55 isn't anymore.
Older drivers as a group are involved in a higher proportion of fatal crashes.
I stopped driving at night.
Over the last few months, I was like seeing double almost.
The lights were too bright.
Being in a fog is about what it's like.
Safe driving is dependent on a lot of factors. Your ability to see clearly and see hazards as they're developing are a major input in order to avoid accidents to begin with.
It's real tough on anyone when you go to a scene and realize that something could have been done to prevent this accident.
Chances are, if you're over 65, you've experienced some vision reduction caused by cataracts. Each year, about 14 million lens implant procedures to treat cataracts are performed worldwide. It's the #1 surgical procedure for adults over 65. Having cataracts affects your vision and more. Cataracts affect your life, especially reading, watching TV, or driving, particularly at night. This video will help you understand a breakthrough in lens implant technology that can mean safer, sharper vision after cataract surgery compared to traditional lens implants. It's called the Nclex-Ms intraocular lens, and you'll learn how this breakthrough provides quality of vision that no other lens has been proven to provide. As we age, all of us lose what's called contrast sensitivity, or in simple terms, the quality of our vision declines. Our vision is not as clear in objects in lower light conditions, such as a gray truck or a child in a light jacket at dusk, become increasingly harder to see. Cataracts make this decline in our vision even worse.
You can still see, but it's just dull, you know, nothing bright.
It's getting harder and harder for me to read. And again, I don't like to drive at night, and even when I'm in the car, during the daytime, if that rear view mirror, if the sun is hitting that mirror, then I'd have to turn the other way.
Well, I didn't like what was happening. I wanted to be able to see things, because I've always been able to see pretty well,
Before we go any further, let's learn more about what a cataract is and how it is treated. The human eye has two lenses that work together to focus light onto the retina. The outer focusing lens is called the cornea. The inner focusing lens is called the crystalline lens. Light rays pass first through the cornea and then through the crystalline lens and are focused onto the retina. From the retina, these light rays are sent as electrical pulses to the brain, where our mind sees a picture of what's in front of us. The natural crystalline lens of the eye is made mostly of water and protein. For most of us, sometime in our 60s, 70s, or 80s, some of this protein will clump together, causing the natural lens inside the eye to become discolored and clouded. This clouding of the natural lens is called a cataract and is usually a natural part of aging, but can also be hereditary or caused by disease or injury. When the natural lens gets clouded, light rays become scattered and no longer pass clearly through to the retina. At first, this cloudiness may affect only a small part of the lens, but over time, the cataract usually becomes darker and harder and has a greater effect on vision. As cataracts develop, all objects, whether near or far, become blurred, and vision usually worsens. One of the results of developing a cataract is the loss of ability to see in low light situations or at night. Other signs of a cataract include hazy or blurred vision, colors that seem faded or not as bright as they once were, sensitivity to light, and frequent changes in eyeglass prescription. The only treatment for cataracts today is to remove the clouded natural crystalline lens, the cataract, and replace it with a clear artificial lens, or IOL. To remove the cataract, your surgeon will use a technique called phacoemulsification, or phaco for short. The phaco procedure begins with a self-sealing microscopic incision that allows the surgeon to insert a tiny probe. Next, the thin front surface of the capsular bag that contains the crystalline lens is opened to provide access to the cataract. Your surgeon then uses the probe to gently break up the cataract and vacuum it out in tiny pieces, making way for the placement of the Nclex-Ms intraocular lens implant. The Nclex-Ms lens implant is then inserted through the microscopic incision and into the lens capsule where your natural crystalline lens was previously located. Following the procedure, the Nclex-Ms lens implant will provide safer, sharper vision, more like your own natural lens did when you were a young adult.
I was in and out of there in less than 2 hours. No pain, and I was totally unconscious, but yeah, it was just amazing how fast and painless it went.
It's simple, it's fast, and it's great to have it done. And you can see again, just like when you were a kid.
The results were almost instantaneous. I couldn't understand why I couldn't drive home, because I felt like I could see really well enough to drive home, but I'd have somebody take me home.
Extracapsular cataract extraction is a form of surgery which consists of removing the lens, but leaving the majority of the lens capsule intact. High-frequency sound waves are sometimes used to break up the lens before extraction. Another form of surgery is intracapsular cataract extraction. This involves the removing the entire lens of the eye, including the lens capsule, but this is rarely performed in modern practice. Cataract surgery is a fairly safe procedure. However, there are some complications, such as endophthalmitis, posterior capsular opacification, and retinal detachment.